Many patients come to our office and they're almost demoralized and sometimes perhaps disappointed that they have already had perhaps a metabolic, or what they tell me, weight loss surgery, and they've not been able to meet their goal. Either they were not able to lose as much weight as they wanted to, or they simply did not lose much weight at all. In this specific situation, here is what I tell all of my patients. It is not necessarily that the patient failed the procedure, but the procedure probably failed the patient. What does that mean? So for example, the band, which was a very common procedure in the old days, we know now probably works in only 7% of patients and a maximum of 10%. So 1 out of 10 might be able to lose enough weight and keep the weight off. So a big portion of the patients that we see have either already had the band and would like to have another procedure that perhaps either works differently or allows them to lose enough weight. And not simply the band, but also other procedures, such as, for example, somebody's had a sleeve and they're 7 or 8 years out now. They're able to lose significant amount of weight. Perhaps the weight slowly crept back on. There are other things that we can do. Essentially, we can tune up the body. So you can continue on either losing more weight, if that's what your goal is, or maintaining your weight loss. So my message here to you is, do not think that simply because you've had one procedure done that you have failed, simply because you are not able to lose enough weight. Remember, if you have blood pressure and you go to your doctor and they give you one medication, your blood pressure is not well controlled, they add a second, and sometimes they add a third. For some reason, there is not a stigma against that, but there is a stigma against patients who've had one procedure only to try and get themselves healthier by losing the weight and getting the benefits of the metabolic procedure.